Over the 25 years of practicing cardiology and internal medicine, I've treated patients with many advanced diseases. Following these patients, despite the advancement of technology that we've had, the patients continue to get sicker and sicker. In my busy practice, my health started to decline. I started noticing that my cholesterol went up, my blood pressure was up, and I did not want to take the same therapies I was prescribing other patients. I'm Dr. Baxter Montgomery, and I've been practicing the world's largest medical center for more than a quarter of a century. Our center is quite unique. The Montgomery Heart Wellness Center is located here in Houston, Texas. We have state-of-the-art diagnostic and therapeutic tools. I have a background in biochemistry. I have medical specialties in internal medicine, cardiovascular disease, and cardiac electrophysiology. So I started doing my own research. I got into nutrition. I ran across a local individual who was an expert in doing nutritional detox. And I went through a natural detox in cleansing my system over a period of 33 days. In that period of time, I felt amazing. I felt like I was 18 years old at the age of 35. This caused a light bulb to go off. If this can cause me to improve, this could have an impact on my patients.
The body has the ability to heal itself when properly nourished, rested, and hydrated. We know this is effective in getting people back on their feet. However, I have a hypothesis that this intervention is even more powerful than that. This intervention, I think, can get people back to peak levels of performance. So we brought together a group of athletes who had performed at peak levels at some time in their lives. And we're going to work with these athletes, despite the fact that they're coming in with chronic ailments such as high blood pressure, heart failure, arthritis, and many other chronic illnesses. It is our impression that this intervention not only will help their bodies reverse these chronic illnesses, but it would also help their body get back to a level of peak performance. If you can go back and turn the clock, go back to a time where you were at your peak performance, would you do that? This is Heart and Soul of a Champion, Athletes Edition, Season 1. I've been working with Wendell Mosley for several months, and I thought, based on the previous findings, he would be a perfect candidate for this program. He had gone through a detox program successfully. However, there were a few setbacks that he had that affected him emotionally.
So I didn't really start playing football until like the 6th grade. By the time I was in the 11th, 12th grade, now I was getting a lot better and, into a starting position on the high school football team. A cousin of mine that gave me a call one day and said, man, are any schools still recruiting you? He said, well, I got a place that wants to look at you. I said, wow, let's do it. So he said, yeah, so I got a coach up at University of North Texas. And so I walked on after my first semester there, I earned a full scholarship. Senior year is when I actually started and led the team.
His initial reason for seeing us was that he had had a previous diagnosis of prostate cancer. So he underwent the prostatectomy. He had a successful procedure. And so he was seeing us after the fact. However, despite him having gone through the surgery successfully and doing well, some of the numbers were not looking ideal. And his urologists were telling him that, hey, maybe we're gonna have to put you on hormones or some other type of medical therapy. And when he asked him again about lifestyle changes, he was given no answer. And he was feeling demoralized. Oftentimes patients are just focused on, well, my numbers are going up. And he was just focused, well, the numbers are going up, so I'm gonna get the other test. What does the next test show? What does the next test show? I wanted to get him out of this mindset. I wanted to get him out of this frame of work. I wanted to get him back on the football field, on the gridiron, to take him back to a time where he had other goals. I want him to put him in a space of going after goals beyond improving laboratory tests. This was going to put him in a different mental space, and this was going to help him heal his mindset about his disease state. So I've known Kenny Banks for a while and met him through his work with hyperbaric oxygen therapy, and had worked out with him once or twice, and I knew that he was physically fit.
My name is Kenny Banks, 55 years old. I'm a former world-class high jumper and competed on the professional track circuit in the 80s to the mid-90s. Been in sports pretty much all of my life. Tried out for a couple Olympics. Love to still work out and stay active. And that's just a big part of my daily routine, and sports and athletics keeps me healthy.
When I started this project, my idea was to have him come in and push the rest of the group because I knew he was physically fit. However, here we are on day one. His blood pressure looks great, but after doing a stress test, my PA notifies me that he has a significantly abnormal stress test. And when I reviewed the stress test, had very significant EKG changes consistent with coronary disease. My concern is that someone like him, being seen by a typical cardiologist, would be scheduled for a coronary angiogram and a possible stent placement. The question is Kenny Banks at risk for heart attack or even sudden cardiac death? Our initial evaluation of Darryl Green when he came in, he seemed to be in pretty good shape. He didn't have any significant symptoms. He didn't have any symptoms of chest discomfort or shortness of breath. He had pretty good energy level. So I felt that he would be someone that we'd be able to start off with and start getting, to that higher level.
I am a former professional football player, 20 years in the NFL, with the team formerly known as the Washington Redskins, presently known as the Commanders.
Our problems with Darryl Green is that he presents to us with, number one, reporting that he has not seen a doctor in 15 to 20 years. And the problem with that is that he essentially has no baseline data for us to evaluate. The other problem that he presents to us with is that he's lived a standard American lifestyle from a dietary standpoint. Now, he does exercise from time to time, but he hasn't exercised in about 2 years based on his report, at least not on a regular basis.
I'd like to live long. I like to live long because I like to have an extended impact on the world. Super Bowls, Hall of Fame, all that stuff is great because that's a tool in my hand. That's what drives me. So if I can be healthy and be there and participate and use even some of the foolish things of this world, run fast at 62 and people go, and then I got a conversation with you.
Upon the initial set of vital signs, my staff came to me and told me that his initial blood pressure was 191/114. So that raised my eyebrows. When a patient comes with a blood pressure like Darryl Green has, 191/114, this is a blood pressure that's at a level that's considered stroke level. 9 times out of 10, or maybe 9.5 times out of 10, a doctor will send you straight to the emergency room, especially if it's a clinical setting where you cannot get CT scans or other types of imaging. This is a medical emergency. This is the type of blood pressure that doctors typically treat urgently in the hospital, in an emergency room, right away. The other thing we found is that Darryl Green has blood vessel disease. Now, we refer to this as endothelial dysfunction. Essentially what that means that he has blood vessel disease, which could mean he's predisposed to a heart attack or stroke or some other type of vascular problem. When I started this project, I had the goal, the vision to take retired athletes and take them to a level of physical performance that was either near or at their previous peak levels of performance. The tricky part about Darryl Green is that my scientific mind is struggling with my human football fan mind. My scientific mind, my medical mind, is saying this individual is at risk for heart attack, stroke, sudden cardiac death. My sports fan mind is saying this person's physically fit. This person can run a 4.340. This person is superhuman. And I'm struggling within with this individual. And I know that nearly half of the individuals with cardiovascular disease present with sudden cardiac death as their first symptom. And now we have to make a decision. Should that be send them to the emergency room or not? I met Raymond Waddy through Darryl Green. The night before the first visit, Darryl calls me and says, hey, I have this friend, Raymond Waddy, and I just found out after talking to a mutual friend of his that he was recently diagnosed with congestive heart failure. So last night we talked, and I talked to Raymond. His wife is on the phone through speakerphone, and I just shared with him that I think what we do can help. And so he decided to come in. He still wasn't sure what he wanted to do even after coming. However, he completed our intake form, and as of now, he tells me he's all in.
Most of the people that know me call me Ray. If you really know me, they call me Stack, because that means I grew up with you. And probably more known as Coach Waddy. I was fortunate enough to earn a scholarship to go to college to play football. I was an undrafted free agent, signed with the Washington Redskins, and ended up being fortunate enough to make the team and spent a little over 3 years with them. So I ended up going to the St. Louis Cardinals, getting released, the last cut. I left there and came back to Texas as student taught, left Kingsville and went to Canada and played in the CFL with Edmonton and British Columbia. Left Canada, came back to the States in the newly formed United States Football League, and finished my career in '84 in San Antonio.
So Mr. Raymond Waddy comes in, and I look at him. He has a very, very distinctive limp. He's obese. He is wearing an external defibrillator. So he's not the perfect picture of health. My concern with managing a patient with heart failure is that we have two major problems with heart failure. One major problem is that heart failure patients can become very ill and die from overall poor circulation. We call that pump failure. Overall poor circulation leads to kidney failure, liver failure, GI failure, and brain dysfunction. And individuals in this condition are very, very sick and very, very hard to manage. And the other situation with heart failure is that heart failure patients are at risk for sudden cardiac arrest. 1 minute they're up talking to you, the other minute they collapse in death. So sudden cardiac death or slow pump failure. These are two very difficult things that we deal with patients with heart failure. Raymond Waddy's heart failure is so bad that he has to walk around with a device about the size of a transistor radio to monitor his heart in the event he suffers a cardiac arrest.
In 2019, I was diagnosed with cancer. After having a complete hysterectomy, talking about a good husband, he was there with me from start to finish. We cried together, we prayed together, but we got through it. It was very hard. Some of the things that I went through, some men couldn't stand it. He stood it, and he stood with me. I tell you, that's God. That's a godly man and a loving husband. And we've had other challenges. I lost my bonus son. He was my godson, but I call him my bonus son. In January of 2021, he was hit by a car. That was devastating to me, and he was only 29 years old. April of 2021, I lost my dad. In January of 2022, I lost my only grandson that was 17. I'm still having a hard time from both of those, and he's been right there by my side. So, it's been a lot for me.
I lost my brother in March to brain cancer. Leading up to before I was diagnosed, I had been feeling very tired, very fatigued, and I started having shortness of breath. And so my wife said, well, you need to get an appointment. So I got an appointment with my PCP. He did a EKG and they found an arrhythmia, abnormal heart rhythm. So he sent me to the cardiologist. The cardiologist called me in and told me that I had congestive heart failure. That was a lot to unpack.
When we got that news, we were both just like dumbfounded.
It was just a lot of unknown uncertainties. What did that mean, congestive heart failure? Am I going to have a heart attack? Or is my heart going to stop working? Which basically is a combination of all those things that could happen.
The most important thing that I noticed about Waddy, he has this continence, his facial continence of hopelessness. That is the most worrisome symptom that he has, in my opinion. That symptom is the most difficult symptom to deal with any patient. When a patient has lost hope, then that patient is a patient very difficult to treat. My main intervention with Raymond Waddy on day one has been to introduce a sense of hope and direction. What we're doing with him today, come up with a game plan toward healing your heart. And this is the strategy. And this is our plan for victory. I'm taking him back on the football field. And I'm giving him a plan for victory. And this time the victory is to heal his heart. Well, during his treatment on the ECD bed, I walked up to him and I said, well, what was your best time in the 40-yard dash? And he told me it's 4.49 seconds. And I said, great, that's your goal. Your goal is 4.49 seconds. Now he looked at me and laughed with a look, hey, this sounds ridiculous. I said, no, I had a very serious face. I'm very serious. Your goal is 4.49. And I talked to my staff and I explained what we were doing. I said, look, Mr. Raymond Waddy's best time in the 40-yard dash was 4.49. Our goal for him is 4.49. Every time you see him, I want you to say 4.49. It's a realistic goal. And it's a goal that we want him to make his own goal, even if it's a lifelong goal. 4.49. One thing we've dealt with in our approach to treating patients with chronic illnesses is a paradigm shift in our thinking in terms of how people should age compared to how we currently age. If we look at individuals who are aging, who are developing chronic illnesses, our natural thought process, or at least our current thought process, is there's a debilitation over time. Similarly with athletes, but the everyday individual. But what we've come across is a different way of thinking about this, based on our historical clinical evidence and clinical experience. The paradigm shift that we have come to is that individuals should improve their performance over time, not decline. Because seeing how individuals with severe illnesses who are on death's door can turn around and be revitalized, can we get retired athletes to function at their peak level of performance when they were very young, regardless of their baseline medical condition? That's what we aim to see.
These athletes are going to be surprised at the accomplishments that they will make during this program.
Maybe this is something that can help me. So I'm here. I just think it's something that prayerfully that would be a benefit to me and other people as well.
I'm excited. I'm ready to try to do this. It'll be interesting though to see what the change is from where I have started my baseline, right? So that'll be an interesting part to see.
I'm really excited to get this challenge on. These guys are very eager. They don't know what to expect, but I do. And I think they're going to have a great outcome. I certainly hope that you've learned a lot from our different participants and athletes. We really think that you can benefit from this experience personally. We invite you to come and revitalize your heart and activate the champion in you.